Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so don't forget to subscribe and stay up to date. Let's get started. Today we're going to take a look at this picture. It really says it all. You can see these teeth are untreatable and that we will definitely need to extract everything. This patient is about 80 years old and he's complained about pain in areas crowns 36 and 37. When you look at the hygiene of this patient, you can see health problems first of all. You know that there's a huge amount of inflammation and you have gingival recession and you have bone resorption. You have almost all of the problems that there could be, but he didn't want to do anything except treat the source of the pain. So at first, those two crowns fell, so he went to a different clinic. They cemented both of the crowns, and when the pain didn't go away, he came to our clinic to check the source of the pain. This was the x-ray. You can see that these 3 implants were placed around 10 years ago. He said he wanted us to just take out the bridge and try to treat the pain. We told the patient that the implant will come out with the bridge. And when the time came, we realized that the cemented method that was used to cement the bridge was permanent cement and not temporary. So it's almost impossible to take out the bridge. We didn't want to harm those implants. This is the cement. This is the residue of the cement that the doctor used. And in this case, you need to remove the cement, the bridge, mechanically. Just cut out the bridge and remove the pieces with a diamond burr, something like that. Those crowns were PFM crowns with a lot of metal, so it took a really long time to remove those crowns. You can see here the implant after the procedure and the implant that he was left with. These are the crowns, and you can see that we looked for the screw channel. We cut the crown, we removed it, and in the end, the residue of the cement. We removed the bridge with the implant. It's an implant that you can't leave in the mouth because you have inflammation around the implant. You don't have any bone absorption in the implant. Just remove the implant as is. It came out pretty easily. You don't need to do anything. If it was a single tooth, you just take out the tooth with the implant. We've made new bridges for the patient. These are PMMA bridges with small screw channels to make the bridges as strong as possible. If you see a PMMA with a small screw channel, you know a sleeve was used. In many cases, it's better to use a sleeve because you don't want to screw it too tight into the screw on a PMMA because PMMA is a soft material and with time it can unscrew. We took out the bridge that he had, we removed the problematic implant, and we changed both of the posterior bridges to new ones. We instructed on the cleaning process that he needs to do. You can see right now that it's much easier to clean and you have a little bit of a pinkish color in the gingiva and not everything is red. This inflammation in the frontal area will remain as long as the problem has yet to be treated. But the patient doesn't want to do anything extensive. He just wanted to treat the source of the pain. He just wanted to do something very specific. So you can't by force treat the patient and remove the implants. It will hold 10, maybe 20 more years. We removed the source of the pain, we restored both sides with 2 new bridges, and in this case, it's even temporary bridges because he didn't want to do anything else. He just wanted to deal with the pain. So that's what we did. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more. And of course, don't forget to subscribe, like, and follow. Thank you and see you next time.